I learned skills that I still use in my practice today. I'm a ward psychologist in a forensic hospital. Since I graduated, I went straight on to an MSc, and then I did the Doctorate in clinical psychology, which I've just finished about 6 months ago. I'm Sara Munir. I studied psychology with counselling theory at UWL. I suppose when I was a teenager, I realised that I wanted to study psychology when I started kind of observing within my peers in school some mental health difficulties, anxiety, panic attacks, eating disorders, things like that. And I started to wonder, why does this happen to certain people and not to others? And I was really looking to study a course where I would learn practical skills, clinical skills that I could apply in my practice. And actually, when I did the counselling theory course here, I learned skills that I still use in my practice today. I'm a ward psychologist in a forensic hospital, which means that I provide one-to-one therapy, group therapy, and kind of consultation to a team in a forensic setting for a particular ward within the hospital. During my undergrad, there was a counselling module where we learned counselling skills. And so we had the opportunity to learn some counselling skills and actually practice those, which really solidified to me that I wanted to kind of go down a clinical route of providing kind of counselling or providing therapy. In the final year, we had the chance to pick optional modules. And I picked a substance use and misuse module, and then there was a module about kind of violent relationships and violent behavior. Taking both of those modules led me kind of to be more interested in like a forensic sort of pathway. But also when I was studying here, I went to the V team, so the volunteering team here, and got a volunteering role doing drug and alcohol outreach. And so that's sort of, again, drug and alcohol problems are quite prevalent in forensic work. So that was kind of another thing that led me to that. Since I graduated, I went straight on to an MSc, so a master's degree in mental health studies. And then I did a few years of work experience in the NHS. And I worked as kind of a mental health support worker and as an assistant psychologist, as a research assistant as well. And then I did the Doctorate in clinical psychology, which I've just finished about 6 months ago. I sort of had a bit of a mentor here within the university, one of the lecturers who was my dissertation supervisor. And she kind of asked me what my interests were. And I said to her that I kind of wanted to go down the clinical route. And she kind of explained a lot to me about the steps that I would need to take to get there, and was just quite sort of encouraging. It is a very stimulating course. It sets you up for a career where you can help people and do good every day. And I think, that's kind of worth everything really to me.